Welcome you all for the discussion of one of the important hydraulic procedure called as proximal compress. So there are two words here. One is proximal, the other one is compress. So let us know about the compress. When we think about the compress, it is nothing but the 3 to 4 folds of cloth dipped in desired temperature of water, saturated with the water, applied over the surface. That is called as compress. So here we can have more folds, like 4 to 6 folds, but there is no covering of impervious material over that. So here we say that the water content in the cloth which is dipped in desired temperature will be more, but we have to avoid the dripping here. So let us go through the details about the compress. Whenever we say compress as such, it is to maintain the temperature for long time, because when we are dipping the cloth in one particular temperature and when cloth is being saturated, it maintains the temperature for long time very naturally. So when we talk about proximal compress, the compress applied to the proximal part of the body, that is nearer to the heart, that is called as proximal compress. So coming to the introduction of proximal compress, the requisites are, as I already told you, folded cloth, minimum of 2 to 3 folds of cloth, then the water at a desired temperature, then we have to dip the cloth in the desired temperature of water and make it get saturated with the water, and we also have to prepare the surface on which we are going to apply. In the proximal part of the body, we can just apply on the arms or on the thighs or on the abdomen. We can just apply on the proximal part of the body. So we have to prepare the body by giving cold friction or just rubbing it with the cold wet towel. So these are the pre-procedures. According to the temperature of compress, we have different pre-procedures. So we have to prepare the surface according to the temperature we are going to apply. So that's about the prerequisites. And coming to the classification, we have two types of classification, one depending upon temperature, other is on the duration. Depending upon the temperature, we have cold and neutral compress. As the temperature says here, the cold is at 60 to 75 degree of Fahrenheit and neutral between 90 to 97 degree Fahrenheit. Then according to duration, we are classifying the proximal compress as short proximal compress, moderate proximal compress and prolonged proximal compress. So coming to the procedure as such, when the temperature is cold, I have told you that the preparation of the surface is very, very important. So we have to prepare the surface with the warm or hot application. Here in compress, usually we just dip one more towel in hot water and just rub the surface where we are applying the proximal compress as a pre-operative procedure, because the hot application, it prepares the body for the cold. When we follow that particular rule as a pre-operative procedure, we are just giving a hot rub or hot application on the surface to prepare the surface for the cold proximal compress. Then in neutral, since it is nearer to body temperature, we can also prepare the body by cold friction. That means dipping the one more cloth in cold water and just rubbing over the surface. So that is how we prepare for the neutral. Since the cold application prepares the body for hot and neutral is slight hot than the skin temperature, we prepare the body by giving the cold friction. So these two are the pre-operative procedures for the proximal compress. Now coming to the operative procedures, in both cold proximal compress as well as in neutral proximal compress, we have to avoid the dripping. In some of the compressors we allow dripping, but here in proximal compress we have to make it a note that we have to avoid the dripping. That means slight wringing of the flannel, the linen flannel will be enough for avoiding the dripping. Then as a post-operative procedure, it goes with the temperature. For the cold, we can just say that the chillness should be avoided and you have to cover the part with the dry cloth after removal of compress, that is called as post-operative. So, we have to cover the part with dry cloth, and we can also ask the person to go for hot water drinking so that we can ensure the heat making power in a person. So, these are the post-operative procedures: avoiding chillness, covering the part with the dry cloth and hot water drinking. Then for neutral proximal compress, we have to go for cold application to the part as a post-operative procedure. So, this is according to the temperature. We have difference in pre-operative, operative and post-operative procedures of proximal compress. So, now coming to the classification according to duration, we had seen that short, moderate and prolonged will be there. The short application is considered to be very efficient within 2 to 3 minutes. So, duration of the short application will be 2 to 3 minutes. It can be in any temperature, cold or neutral, according to the person's condition we have to decide. And moderate is for 10 to 15 minutes and prolonged is for more than 30 minutes. Maybe it can be extended up to 40 minutes also. Here, when we just look at the physiological effects of proximal compress, the prolonged application is more preferred because we want to add up the sedative effect of prolonged duration along with the compress, which is nothing but the constriction. So, we want to have the constriction effect with the proximal compress. So, the duration of the compress and temperature of compress both should be conducive to have the proper vasoconstriction. So, here prolonged proximal compress is more preferred. Coming to the physiological effects, we have a scientific reason for applying the compress to the proximal region. The experiment conducted by Winternes has told that the cold application on the proximal part of the artery will contact the distal part of the blood vessel. Now, when we just consider this, whenever we apply application on the proximal part, especially the cold in cold temperature, it is definitely going to constrict the blood vessels of the distal part. For example, to contract the blood vessels of the hand, we have to apply on the proximal part, that can be on the forearm or arm, so that the cold applied on the proximal part can contract the application on the blood vessels on the hand. The experiment conducted by the Winternes says that ice application on the cubital fossa had contracted the distal part of the digital blood vessels. So, depending upon that particular observation, we are going to give cold application to the proximal part of the artery to have the same effect, that is nothing but the contraction of the distal part of the arteries. So, by keeping that in mind, we are going to discuss about the physiological effects in the next class. So, we will join in the next class. Thank you.